As Guyana prepares to observe World Diabetes Day on November 14th, let us take the necessary steps to adopt healthy lifestyle practices. Remember, your health matters. Now here's what the Ministry of Health has been up to this week as we continue to enhance and transform Guyana's healthcare. On Saturday, November 4th, Minister Dr. Frank Anthony attended a one-day CME session on the Heart's Technical Package. The session was a collaboration between the Ministry of Health's Chronic Disease Unit and PAHU WHO after a 3-day Trainer of Trainers workshop with over 250 participants including doctors, nurses, and pharmacists from various health facilities across Guyana in attendance. This session aimed to sensitize persons on Heart's initiative and the new treatment protocols for high blood pressure and hypertension in Guyana. While delivering brief remarks, Dr. Anthony stated that updated guidelines for chronic non-communicable diseases will be rolled out soon and emphasized the need for healthcare providers to utilize required medication.
We publish new guidelines relating to the treatment of diabetes, and so if you don't know the guidelines, we can make them available because, again, this is moving in that direction. Where we want to have standardized treatment protocols and we want to update our guidelines to make sure that it's what is being used globally. And in some cases, I think we are exceeding what the WHO is expecting of us. So with the diabetes guidelines, we have done that with Mount Sinai, and so we've printed them, it's out there, and I'm sure Dr. Lal and her team can share them with you. So you will see us in the area of chronic non-communicable diseases. You will see us over the next couple of months issue a lot of guidelines in different areas relating to the management of chronic non-communicable diseases. And we want people to follow these protocols, especially those persons who are working in the public sector, because based on those protocols, we would be buying the medication.
Also on Saturday, the Health Minister attended the 16th graduation ceremony of the Institute of Health Sciences Education, of which 50 doctors and nurses graduate from the postgraduate training programs in various fields. These areas include a Bachelor's of Science in Nursing with specialization in cardiovascular nursing, neonatal nursing, and emergency nursing, a Master's degree in Medicine with specialization in orthopedics and traumatology, emergency medicine, internal medicine and infectious disease, obstetrics and gynecology, pediatrics, and psychiatry. Additionally, a few students received postgraduate diplomas. While congratulating the graduates, Minister Anthony had this to say.
So we are positioning Guyana as the hub for medicine in the Caribbean. And there are many areas that we're working on to make sure that we can be positioned in that way. So these are the routine kind of clinical stuff that we're doing. But when you think about last year, the National Public Health Reference Lab that we were able to do sequencing, that's a step in the right direction. So we were able to sequence the Plasmodium falciparum to look for gene resistance. And we are going to continue to do things like that. So one of the parts of that lab, we want to develop a whole area that looks at genetic sequencing. We are going to become the reference center for TB for the Caribbean. CARPHA has already spoken to us because we have more experience with TB than any part in the Caribbean. So we are going to be the reference center. And there are many other things that we'll be doing.
On Sunday, November 5th, Minister Anthony attended the Guyana Medical and Research Conference and launch of Guyana's Journal of Medical Sciences. In the aspect of donations, on Tuesday, 30 wheelchairs were handed over to the Rehabilitation and Disability Department. These items were donated and handed over by Gautam Tani, representative of the Mohan Tani Foundation, and were well received by Minister Anthony along with Dr. Ariane Mangar, the Director of Rehabilitation and Disability Department. Upon receiving these items, Both the minister and Dr. Mangar expressed their gratitude for the timely donation. Dr. Anthony also said he is looking forward for the continued partnership with the foundation. On the said day, the ministry's maternal and child health department received a donation of 13 TCW 120 advanced solar refrigerators to enhance the ministry's immunization efforts and provide support for vaccine storage, especially in remote regions. The donations, valued at $160,000, were handed over by UNICEF and USAID and were delivered to health facilities in remote and hinterland communities across Guyana. While delivering his brief remarks, Minister Anthony reflected on methods through which vaccines had to be transported during the pandemic, resulting in vaccine spoilage. He noted that the addition of these solar refrigerators will aid in distributing and transporting vaccines to various remote communities from the vaccine regional hubs that were established during that time.
And during COVID, one of the things that we did was to build out regional hubs. So instead of storing all the vaccines here, we were able to distribute them out in the region. And now the next step is to really get them out into the various communities. So this is going to be extremely useful to make sure that we have in the various communities this type of equipment.
In closing this week's review, Minister Anthony met with several officials to discuss areas of mutual interest and how they can collaborate to strengthen Guyana's health sector. These officials included a visiting team from the US CDC and the chair of the China Camsi Engineering Company Limited and team. So there you have it for this week. Do continue to stay safe.